Hello, my name is Kayla Galloway. This is Module 15, and the disease I will be discussing today is known as human immunodeficiency virus. What is human immunodeficiency virus? Well, human immunodeficiency virus, also known as HIV, is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. So, HIV harms the immune system by destroying white blood cells that fight infection in our body. HIV is classified by CD4 plus cell counts as well as clinical categories. Okay, so here is a chart that pretty much is going to depict the classification of HIV and AIDS. So the classification system defines three categories that correspond to the CD4 plus cell counts per microliter of blood. So for category 1, if there is more than 500 cells per microliter of blood, then it's going to be within category 1, of course. And then category 2, you can see that that consists of 200 to 499 cells per microliter of blood. And category 3 depicts less than 200 cells per microliter of blood. And these are white blood cells that we are referring to when we say cells. And then there are also 3 clinical categories. Clinical category A pretty much is going to include anyone who is asymptomatic or has symptoms of primary HIV infection. Clinical category B includes individuals with symptoms of immune deficiency, but it isn't serious enough to be considered AIDS. Clinical category C is going to include AIDS-defining illnesses. So it's the most progressive form of HIV. So HIV can be transmitted from one person to another through sexual contact, blood-to-blood contact, or perinatally. Transmission can occur when infected blood, semen, or vaginal secretions from one person to another are deposited onto a mucous membrane or in the bloodstream of another person. So I'm just showing you ways that you cannot get infected. When HIV first became an epidemic, there was a common misconception that you can get it from kissing and hugging and food sharing and insect bites and all of these things, but that is not the case. So AIDS is a syndrome that is associated with HIV. If left untreated, HIV leads to AIDS, and it is the late stage of an HIV infection that occurs when the body's immune system is badly damaged because of the virus. So we discussed what defines the AIDS stage already when we were discussing the classification of this disease. But just to go into more detail, a person with HIV is considered to have progressed to AIDS when, like we already stated, the number of their CD4 cells falls below 200 per cubic millimeter of blood, or if they develop one or more opportunistic infections regardless of their CD4 count. Some clinical manifestations of HIV are going to include fever, fatigue, rash, headache, lymphadenopathy, pharyngitis, arthralgia, myalgia, night sweats, gastrointestinal problems, aseptic meningitis, and oral or genital ulcers. There is a couple of diagnostic tests to test for HIV. These tests include serological methods for detection of antibodies, such as the Western blot test and the ELISA assay, and the antigen detection methods, such as the polymerase chain reaction assay. So ELISA is a pretty common way to test for HIV. And how it works is that there are antigens coded at the bottom of the well, and then the sample is placed into the well, and specific antibodies are going to bind to the antigen. And if these antibodies bind to the antigen, it will cause a different color to be produced, indicating that these antibodies are indeed present. So pretty much you're going to have HIV antigens coded at the bottom of the well, and HIV antibodies are going to bind if someone is HIV positive. Now, a lot of times there is a false negative result that occurs in HIV, and this occurs mainly because a newly infected patient will still be at that window period where no HIV antibodies are being produced yet. So a lot of the times, another test will be used to guarantee that you are indeed HIV positive or HIV negative. So a differential diagnosis means that there is more than one possibility for the diagnosis of a disease, and it is based on similar clinical features that the two diseases may share. Now, HIV, we know at this point that HIV affects the immune system and causes you to not be able to fight off infections as well. And another differential diagnosis or another disease that also shares the same sign and symptom is known as high-grade malignant immunoblastic lymphoma. Now, this is a malignant disorder of the B cell, and it is a cancer that begins in infection-fighting cells of the immune system. And in this case, like I said, this cancer affects the B cells. So some possible complications of HIV include lipodystrophy. That pretty much refers to the change in body fat that affect some people with HIV. It can include a buildup or a loss of body fat. Another complication that can occur is known as wasting syndrome. Wasting syndrome causes a weight loss of more than 10% of your normal body weight, and it is unknown why it occurs. Another complication is known as HIV-related encephalopathy. This is pretty much referred to as HIV-related dementia, which is a degenerative brain condition, and it affects people with CD4 counts of less than 100. Another possible complication of HIV is opportunistic infections.